A new survey shows some of the most vulnerable people to severe flu illness are not protecting themselves. Reporter Bradley Blackburn has more on why getting the flu vaccine is critical for patients with certain chronic health conditions.
Carrie Sparling has been living with type 1 diabetes since she was 7 years old.
I don't know what it's like to live without type 1 diabetes. I've had it for such a long time that it's been sort of tied to everything that I've done, for better or for worse.
And that's why she gets a flu shot every year.
It's another one of those things that I can do to proactively take good care of myself. Having the flu and also having diabetes can add this really nasty extra layer of issues that I would have to deal with.
The flu vaccine is especially important for people with chronic health conditions, including diabetes, heart disease, and lung disease. But in a new survey from the National Foundation for Infectious Diseases, just 45% of adult patients say they've been vaccinated.
It's very concerning because that's exactly the group that's highest risk of the complications of influenza, particularly pneumonia.
Infectious disease specialist Dr. William Schaffner points out during recent flu seasons, 9 out of 10 people hospitalized with flu had at least one underlying health condition.
There were relatively few flu cases last season because of all the pandemic precautions, but this year the flu is back. Some large outbreaks have already been reported.
There was so little flu last year, and vaccination didn't reach the usual levels. There's concern that many of us may have built up some susceptibility to flu. All the more important to get vaccinated.
Though flu shot effectiveness varies each season, public health experts say it prevents millions of infections and can reduce the severity of illness if you do get sick. That's why they want everyone 6 months and older to get vaccinated. Bradley Blackburn, CBS News.
The survey found that patients are more likely to get vaccinated if a healthcare provider recommends it. Nearly 7 million children in the U.S. have tested positive for COVID-19 since the start of the pandemic. The American Academy of Pediatrics says half of all teenagers between 12 and 17 are now fully vaccinated, and 13% of children ages 5 to 11 have received at least one dose. Meanwhile, a new study found most cases of heart inflammation in young people after getting the vaccine was mild and resolved quickly. Researchers studied more than 100 cases of myocarditis, a type of heart inflammation. Nearly all of the patients started showing symptoms after their second dose of the vaccine. The most common symptom was chest pain, followed by fever and shortness of breath. Fewer than 20% were admitted to the ICU. It's still unclear what causes the inflammation. Ham lovers, listen up. Up next, which brand of pork is being recalled and why?